one more session of YouTube and Instagram live. I hope you can hear me properly, and I hope I'm visible properly, because this is a different area from where I'm taking the YouTube live and Instagram live. So welcome everybody, and let us start our session. I hope everybody joins in early so that there is no waste of time. Before we start, start answering the questions. Let us deal today with one of the very interesting rubric, one of the very interesting patient, and how did I interpret that, and how did I got the results. As we say, sometimes we have patients where we say the patient is always on time, and the patient what you call is always on time, everything very neat, clean and all. And what happens in these type of cases, we always take the rubric fastidious, and basically we normally the remedy comes arsenic album. Welcome Dr. Meera. I was just Dr. Kardik, welcome. Dr. Smita, welcome. So there is a very interesting, I gave that patient a single dose of Aurum Ars, and the patient responded very well to the treatment. Now there is a very, very, very interesting rubric apart from that fastidiousness. If you are very interested in learning the repertory, it is said that punctuality, patient always on time. Punctuality, always on time. If you see that rubric in your repertory, and this is a very, very interesting rubric, the patient says that wherever I go, in fact, that patient came with an appointment of 6 o'clock in the evening, and he was right dot at 6 at my clinic. And because of the previous case, there was a delay of about 15-20 minutes. And he said, sir, I was always on time. I always go on time. So make sure that you always call me on time. In fact, in follow-up also, he wanted a time, but then I did not give him the time because I knew that if he comes on time, he'll again have a problem. So these patients basically are, wherever they go, wherever they are, they always decide that they have to come always on time. 3 remedies you must always remember in this, what is given in the repertory. I have always found very good result with Aurum Ars, second Argentum nitricum, and third Kali nitricum. Of course, Aurum Ars, Argentum nitricum, and Kali nitricum, these are remedies which have differentiation in that punctuality. For example, if Aurum Ars, if there is punctuality, the Aurum Ars is punctual, especially when attending a big meetings, when attending big seminars and all. But Argentum nitricum patient is always impatient. He's always impatient. He'll be always there before time, and he'll be always restless. Kali nitricum patient, as the name suggests, is always on time, but wherever he wants to prove his dominance, especially in his inner circle, he will start picking his dominance. So these are the 3 remedies which you should think about. The patient is always punctual on time, and the differentiation is very important. Dr. Palak, Dr. Anurag, Dr. Alexandra, Naresh, Bavalkar, Dr. Kumar, Dr. Nilesh, everybody, good afternoon. Everybody has joined in. So I hope you understood the differentiation of punctuality. That's important. And then when you get a rubric, it is important to differentiate with mathematics. That's very important. So, sir, can you repeat after 1 year of carcinosis 10M or not? Yes, you can repeat. Repetition depends upon the susceptibility of the patient and how the patient is reacting to your treatment. It is not a law that you can't repeat after 1 month, 2 months, 3 months. It depends on case to case how the patient is reacting to your treatment. That's important. Hello, sir. Any good remedy to reduce itching or ichthyosis patient? Itching, if you see nowadays, there is a lot of problem of itching, a lot of fungus and damp weather, and we immediately pounce on the remedy of wet weather aggravation. We have Dulcamar, rhododendron, rustox, and these are very irritating diseases, very irritating, itching. Believe me, itching too much is because of low immunity, and that is because of some stress, some agitation in mind which is not getting resolved. Unresolved agitation. Patient takes out the clothes and starts itching. Whether it is any disease, it is that important. So it is whether ichthyosis or fungus or ringworm, you take that as an entry point. Special medicines for itching I have never seen in my practice, nor I have given. But a lot of doctors suggest histamine, prepared from histamine. But I have not seen results with histamine. So you can try. But for me, it is because of that irritation in the mind. So do take care of this symptom, because this will give you lot of inputs with other remedies and other patients also. Dr. Alamagir, welcome. Bloating, burning in chest, restlessness, weakness. Depending on the age, old age is also a problem. Eat good food, more in protein rich food, so that this symptoms will be taken care of. Mira, for that case of recurrent I think aches, I have told you, Asteria Rubens, do think about carboanivalis also, that's also very important. And I think there was a one case, Dr. Mira, I don't know, whenever there is shouting, you told me, whenever there is somebody is reprimanded and scolded, so that I'll tell you, I'll give you an answer about that in short while. Just a call. I have a question on call. Please don't call and ask the question, because it will be very difficult for me. Next, as we go further, so punctuality, it is important. Punctuality is important. Second thing, reproaches self and reproaches others. Now that is also very important. If you see arsenic album, it is reproaches others. As I told you before, in my, I think it was my, so don't please put a question on WhatsApp, so it becomes very difficult to me. So when you are basically seeing reproaches others, arsenic is a patient, it is written that arsenic is very autocratic, aristocratic, fastidious. He is so much fastidious that it sometimes pains the person who is living with him. He wants the AC at 26, so he says something at 25. No, it is very cold, do it 28. Then say something, do it 26. He will ऐसी हिंदी बोलते पगला बना देता लोगों को. He will make the person mad. That's arsenic album. China is also there, reproaches others. A China patient always desires basically what we say, everything branded, everything good, everything fantastic. That's China. You will be very much petrified if a China is there. He wants everything very, very according to the what you call inverted commas. That's China. So you differentiate those remedies, so it's easy for you to prescribe. Okay. So as we go further, yes, any other questions, or I will start something out mine. In fact, if you have remedies like I must have discussed arsenic mind before in the last YouTube. Now there were a lot of questions. I sir discuss something more, but if you start asking something about one remedy, whole half an hour gets lost, and then we cannot think of anything else. So in the same way, China. Okay, Akshita. Okay, in the same way, China. Now, if you open your Matermedica and see China, of course, see some remedies sometimes are basically taken as in a prejudiced mind that this is the remedy. China is a remedy which is a very, very interesting remedy. It is said that in China, the patient is inclined to vex others. Inclined to vex others. And it is such an important remedy in China if you don't get any other symptom. But if a patient is inclined to vex others, do think about China. A very, very, I have never failed if I have prescribed China in this symptom. Remember this symptom, very, very important, and very, very important entry point of China. Second symptom that you should always remember in China is that the patient has anxiety which is inconsolable. You cannot console an anxiety of China patient. Do think about aconite or spongia or viratram, naxomica, but do not miss China. And one symptom that is very, very important of China, it is as at par as arnica, anxiety after injury. Please write down in the Matermedica, anxiety after injury. Of course, arnica montana is there, but China is also there. So whenever these symptoms comes to your mind, do think about China. In fact, in China it is written that a China patient, when he goes to buy clothes, he always keep changing his clothes, always keep testing his clothes in the mall. And that's why the China patient says that you will tell to his wife, tell to his mother that you bring the clothes, because when he goes to buy clothes, he finds all clothes are too tight for him. All the clothes are too tight for him. A very, very important entry point of China. Think about China, think about Thuja, think about Argentum, think about Epismel. But China, I have found a very, very important symptom. Okay, One more symptom. Okay, there is a question, so that I will answer. Then go for China. I prescribe the medicine Medorum 1 mg. Can I repeat after 1 month or not? When to prescribe 10 mg after I used as an intercurrent remedy? If you have used Medorinum as an intercurrent remedy, we use intercurrent remedy either because the case is not going as per your way, or the case has stopped giving result. So once you think that Medorin was an intercurrent remedy, there is no need to repeat, there's no need to repeat because you have opened up the case with Medorin. If your prescription is not right of the previous remedy, then maybe you have to change the previous prescription. I have not used Medorinum 10m in my life. I think either once or twice. I have never used 10m because Medorinum, if you use as a constitutional remedy, it is something different. As you use an intercurrent remedy, something different. So, if your previous remedy is right and you are using only Medorinum to open up the case or to because the action of medicine has reduced, then 1m is sufficient. Okay, then no need to repeat. Yes, my son's case, whenever I get angry or shout loudly, he suffers from high grade fever with cough. So the most important treatment, Dr. Meera, would be don't shout. Okay, take it very politely, because I think he's a very mild and a yielding child, so there's no need to shout. Sometimes what happens, that we are at the clinic and the prescriptions are not good, the patient is not giving results, so maybe you shout on your child. But these are the remedies, and if it is a very recurring problem, then I'll then add some few symptoms, or I'll give you the remedy. Okay, that's okay, there's no problem. Good afternoon, Dr. Paul. Erectile dysfunction in 34-year-old man unable to maintain erection, had already taken Damiana, Nuferlute, Selenium and Yoibinum. Okay, so erectile dysfunction for Damiana, Nuferlute. Okay, these are the specific remedies for erectile dysfunction. I'll just differentiate one. Don't use these all specific remedies. Yoibinum is a very, very important remedy when there is impotency because of some nervous cause. One line boric metremedica, psychological impotency. After marriage, a man comes, and I had a very interesting case. A man comes and he could not perform, I think on the second or the third night. And now the wife thought that the husband thought the wife may have an upper hand. So whenever he used to go for that intimate relationship, he used to always feel, what will happen if I don't do it properly, if it does not happen properly. And he was suffering from that trauma that he could not perform. And that was psychological impotency, and Yoibinum is a very good remedy for that. Selenium. Whenever if you have a case where the patient is suffering from elements from lot of prostaturia or masturbation, and that's why the patient is very weak, and that's why there is a impotency or problem in action, give selenium. So I have never used this remedy. A lot of people use Damiana mother tincture, for against cast mother tincture for impotency, but don't give that blind prescription. Give me some symptoms, 34-year-old man, and if you want to prescribe, I think one dose of a perfectly indicated Similumab should cure the case rather than repetition with this. For me, you do one thing, doctor. I don't know what's the name. You do one thing. Take a good case of the patient, counsel the patient, and say there is no problem with him. Unless he's diabetic, or he's taking a lot of alcohol, or he's taking a lot of cigarette smoking, just give him placebo and just change the action of placebo. Give morning placebo in hot water and tell him to take placebo at 8 o'clock, 9 o'clock in cold water. Give him some diet restriction just to discipline the patient, and then ask him, he will definitely perform better. I feel it's psychological impotency. If not, then take a case and then get back to me. Best potency for pathological symptoms, I normally start with 30. 30 potency is the best, and for me, best potency, if you ask for pathological cases, do 50 millisecond potency. Welcome, Dr. Weber, Dr. Nigam, Dr. Paul. These days, there are a lot of symptoms, a lot of dengue cases coming in our day-to-day practice. In fact, there was a time where I used to see every day about 15 to 20 dengue cases. Believe me, nobody was hospitalized. Everybody got good results with homeopathy. I have found one thing in dengue, that the time when the patient comes to you, that's very important. If the patient comes to you on the first day, second day, third day, the prescription is absolutely fantastic. It will cure it very, very fast. But if the patient comes after 5 days, and the patient says that I have no fever, You do the platelet count is 20,000, 25,000, that the problem starts. And of course, antibiotics have no role in dengue, but when the platelets fall, the TLC also falls, and that time the patient is exposed or very susceptible to secondary infection. So it is very important to take care in that phase also. So there are different remedies which I have used and I have got fantastic results. So a lot of questions were there on my WhatsApp. That what to treat for dengue and all. Dengue is absolutely treatable with homeopathy. There is no other problem. Just the timing when the patient comes to is very important. That's important. Okay, I hope, doctor, you understood something about erectile dysfunction. Otherwise, see, we can go on and on. There are a lot of other remedies, for erectile dysfunction. Whenever your mind is affected and there's lots of memory and there's a lot of prostration of mind, and that's why erectile dysfunction, then Agnes Cas is indicated. That's so. I hope I was not very fast in my answering. I always tell that that I'm very. I try to speak slow, but okay. But I'm a bit fast in answering. I hope you got the answers. And every time I tell I don't understand whether you're understanding what I'm speaking, or because I'm very fast you don't understand. Always give me a thumbs up, or give me a hearts out, so that I know that I'm speaking and you're understanding what I'm speaking. Okay, so make sure you do that. As we go further, okay, yes. So as we go further, there are the Homeo Shine. Thank you. Good afternoon, Dr. Gurudev. Yeah. So as you go further, and Dr. Meera, just to add, if there are no questions now, you can take a very interesting rubric, sensitive to reproaches or sensitive to criticism. Then you have a wonderful remedy, Dr. Meera, carcinosin, medorinum, calcarea carb, and I think ignitia is also there. So your child, whatever I have seen your child, he appears to be more of carcinosin. So you can start with carcinosin 200 single dose and then wait, and he will maybe get immune to your, getting angry. And then you will get angry because he's not getting angry. He's not what you call listening to you. That should not happen. So carcinosin would cure that case. So give him carcinosin 200 single dose and then wait and watch. Unless there are other symptoms, then we can see. Female age 32 years, pain in vulva before coition, had never sexual intercourse after marriage, stiffness of lower extremity during attempt, give arnica 30, please give a light. Okay, a very, very interesting case, and we have lot of cases. In fact, I had a case where the vulva was so sensitive, they did not perform that intimate relationship for 2 years. So much so that the patient, when the patient came to me and he said that, doctor, he was not from Nagpur, he was far away. So when the patient came to me and he said that she was not conceiving, and she gave me a history that the doctor had to give some lignocaine jelly to apply it to anesthetize that part, so that there is no pain and the relationship would be made. So that was the height of sensitivity, and this is a very, very common symptom. It is written, it is written in a Mater Medica, the sensitivity is so high, it is sensitive to touch also. That is very important, and that's why you can say dryness of the area or sensitiveness of the area. There are other lot of things, which you can think of. But one of the good remedies which I have seen in my practice, of course there are so many remedies, and there are dryness for the vagina or vulva. You can think about, first is platina, very important remedy. Second, think about Merxol. Third, think about Zincum metallicum, and fourth of Viparsal. I just remember a case where I had cured that case with a single dose of Valeriana 1M, one patient, and the second patient actually did not have the problem, but I just counseled the husband that do it with the will and do it with other things also, and the patient reacted very well. The patient used to go in spasm because of that. In that case, Macphos very important and platina very important in those cases. Dengue shock cured beautifully. Kunwar Gummy. How did you come to know? Okay. Okay, Gurudev, sir, intense pain in epigastrium region, especially after taking meal in afternoon. Concomitant loose motion, muscle toner give relief, but not completely. What to give? Uh, Homeo Shine, welcome, Miraya. So, you see, first of all, you have a specific symptom, epigastric pain. Whenever there's the patient complains about epigastric pain. First of all, we divide the abdomen into 9 parts, and then if your what do you call anatomy is very nice of the epigastric region, then your prescription would be very easy. Now, whenever you have epigastric pain, and it is said that whenever there is pain, you must first think about nux vomica, first think about carbovage, first think about colocynth, first think about taraxicum. If you open that mathematica, it is said pain in the epigastric extending to the hypochondriac, extending to the umbilicus, extending to the thighs, extending to the upper part of the body, and the remedy changes. You say it is intense pain, especially after meal. Now, if you have this modality, wherever the pain is, but if you have this modality after eating, just make sure to take which modality. In fact, immediately after eating, few hours after eating, or in the night after eating, beginning after eating, there are a lot of other things, so you can write down. After eating, you can think about few remedies, very, very important: Staphylococcus aureus, graphitis, Veraton. I have got very, very good results with these three. Of course, sulfur and thuja also there. But if you have if you have given Merxol, then you must think about remedies like, write down the remedies. You can think about Staphylococcus aureus, you can think about anacardium, and you can think about Tarantula. These are the very, very important remedies. Selenium potency for ED due to masturbation. Masturbation potency, start with 200 potency. Start with 200 potency. If the patient says it is basically gradual release, then you can increase the potency, but don't jump with 1 ml. 200 potency is fine. Dr. Rushali Vengulera. Okay. Yeah, we had a beautiful case of dengue shock, cured beautifully. Fantastic case and fantastic results. I shared that case with some of the doctors. They were very happy because, see, these type of cases and these type of prescriptions you basically get, you have to be lucky to get these type of cases, and I was lucky to get this case, and still even lucky to have cured that case. Fantastic case it was. Okay, so thank you, Dr. Kumar. Okay, you are Navjot. Okay, yeah, Navjot, thank you. All sir, just few minutes later pain started after meal. Okay, so in your case it is basically immediately after meal. Then I have a remedy which I have used in my practice of late and giving me good results, and that is Elexon. First is Elexon, second is Ferrum Metallicum. These are the remedies which I have used, which are immediately after eating. कि पेशेंट बोलते खाना खाया और पेन होना शुरू हो गया. Third thing, you must think about Robina. Fourth, you must think of Argentum nitricum, and fifth, you must think about Kalika. Navjot, yes, you are Navjot. I've got it. Okay. Okay, so that was fantastic, Dr. Navjot, and thank you for referring those type of cases. That also gives me confidence in treating and actually believing that homeopathy can do this also in a practice. It was a fantastic case of dengue hemorrhagic shock, malignant dengue, and it had a very good results. Thank you so much for sharing this case, sir. Electropathy helps in diabetic neuropathy or varicose vein. Electric therapy in diabetic neuropathy or varicose vein. I did not get the question, Dr. Rushali. If you can write again. Dr. Maitri Clinic, welcome. Please guide what to give after viral fever if there are severe joint pains which is left after allopathic treatment. Yeah, so many cases, so many cases where after viral fever, strong medicine given, and then the patient suffers from joint pain. There is a rubric in the repertoire, pain inflammatory after influenza, after viral, or after influenza, or after acute disease. Just do some homework, go to that rubric, and there are a lot of remedies. If you ask me, in that case, normally we have been told give nux vomica first, give aloes first, basically what I have seen in my practice, that whatever the residual symptoms are there at that time of symptom of the patient, prescribe on those symptoms and you will get the results. I have given Rustox, I have given Goicum, I have given Kali Ars, I have given Calcarea Sulf, I have given Calcarea Carb, I have given Symphytum. Those have given me good results. Ah, fantastic, Dr. Navjot. Do share that video of dancing, and I'll be very happy to make a beautiful case of that case. Thank you so much. So do send the video also. Okay. So, any more? Yeah, a case. Good afternoon, sir. A case of 30-year-old had leukorrhea like watery consistency, profuse, unable to bend left knee, causing I gave creosote, ruta, no change. See, whenever you get cases where the patient is telling me that my left knee is a problem and right knee is a problem, okay, if you are very happy with that symptoms, be very happy. But then just if you take that rubric, stiffness, if you take the rubric stiffness and just prescribe on knee symptom, generalize, I could give you that left knee remedy different, right knee remedy different, but I have got cases where I have just taken knee generalized symptom. Remember 3 remedies which are very, very important in this type of cases. First you have to think about Rustox, second think about Bryonia, and third think about Causticum. Now there are some remedies which your rubric matches with the symptom is Silicea, Lycopodium, and then the third remedy is sulfur. So these 6 remedies, I think one of the 6 remedies you should think about, and that would give you very good results. Okay. Okay, could you write some questions, anybody, because they must have scrolled up. I don't know exactly what questions I have missed out. So and again, doctor, stiffness, if you say, then there are other symptoms. Pain in the epigastric region and feels around the navel, sensation of heaviness, pressure always emulates. No, so pain starts in epigastric region and feels spread around the umbilicus region, sensation of heaviness, pressure always ameliorates. Okay, see, whenever heart pressure ameliorates, you must think about in these cases China. Second, you must think about in these cases Bryonia. Third, a very, very interesting remedy you must think about is Chelidonium. Fourth, you can think about, again, these remedies are very rare, but I have found good results. Iris versicularis. But in iris ver, again, you have to add that symptom with nausea. And then you have a lot of remedies, with this type of problem. But these 4 or 5 remedies are important. In fact, I had a case, where the patient suffered from these type of complaints. I gave some remedy, it did not work, but we found out that it was because of worms, and then Sina cured the case. So in homeopathy, it is very important to understand why, how, and then the modalities. Okay. Sir had history of candid vaginitis. Okay. So iris ver is ruled out, in this case, and then you can think about the remedies. Okay, but again I tell you, whenever you get cases of pain in the abdomen, you must always understand why. Because the abdomen pain, you give a remedy for pain in the umbilicus or in the navel, it then shoots up and goes to the hypochondriac region. Only the site would change. So if you see pain in umbilicus, then you have to differentiate. It is morning or evening, in the night. Then a lot of remedies. Chelidonium is there, and leptendra is also there. Colocynth is there. Veratrum is there. Gambogia is there. Granatum is there. A lot of remedies. Then differentiate in the morning, in the night, eating after. In fact, I had a case where the patient had classically told me symptom eating after, and oxalic acid cured that case. Okay, that's also very important. Okay, nausea is not this. So history of candida vaginitis is there. Yeah, okay. So that's okay, Dr. Homeo Shine. That's absolutely fine, because we are basically treating these cases on symptomatically. So if a lot of cases, most of the cases, the ladies comes to us by applying that either candid ointments or a ketoconazole, that antifungal treatment, or any these medicines, and then they come to us. So that's okay. But candid, what we do, it would cause a lot of dryness in that area, and it would not cause that sensitiveness of the vulva. But sensitivity, what I have told you, that my answer stands the same. That's the same remedies you can try, and you will get results. Okay. Any questions more? So I think it's already 3:35 and we are through with half an hour. So I got lots of thumbs up. Thank you. Please guide us, giving us curing viral fever in siege after any mode of treatment. Yeah. So maybe I'll make a video and on the YouTube and update that. Okay. Fibrosis in urethra, of course you can take that rubric, constriction and stricture in urethra, and there are a lot of remedies you can go. So we are through with half an hour, and thank you so much for joining, and I hope you enjoyed as much as I enjoyed teaching you and sharing my knowledge with you. Thank you so much. Until next Saturday, bye for now.